should be automatically recording. Yes, it is already recording.
Oh, cool.
People waiting in the lobby. Oh, great.
Has it worked okay?
Yep.
Oh, cool. Hi, everyone.
Good afternoon, everybody. We'll start in a minute or two formally, just to let people into the meeting room and let people arrive. But we're here and ready to go, so delighted to be.
Mute. Here we go. Yeah. Oops. Microphone.
I don't think anyone's talking, love.
I think they are. He's. Of course they are.
We haven't started anything yet. For those who are still logging on, we'll be starting in about a minute or so. But if people are logging on and getting their microphones and things set up, we're not started yet.
Okay, so there we are. It's not. They're not starting yet. Okay. We might come up until unless we talk. Should we get the washing then?
Oh,
No. Mm.
Okay, everybody, I think we're good to start. More people will certainly join us as we move further into the session, but I think we shouldn't wait any longer to get started on today's Queensland Heat Health Community of Practice event. Delighted to have you all here. My name is Dr. Tony Matthews. I'm a co-lead of the Community of Practice along with Associate Professor Shannon Rutherford, and it's our great pleasure. Hello, Shannon. It's our great pleasure to welcome everybody along to today's session, which is about inclusive heat health solutions and takes a cross-sectoral perspective on various actions for and in a warming climate. Ella, if you wouldn't mind, please. Now, just to briefly acknowledge a brief acknowledgement of country before we begin our formal proceedings. Griffith University, who I'm affiliated with, acknowledges the district. Oh, are we gone?
No.
Oh, there we go. Thank you. Griffith University acknowledges the traditional custodians of the lands on which we're all meeting and pays respects to the elders past, present and emerging, and extend that respect to all Aboriginal and Torres Strait Islander people. I'll be doing a very brief welcome and introduction to the session this morning. I won't take too long about it. I have a few things I'd like to share with the audience before we get going. Then we will have 3 separate talks, each one running for 15 minutes. The format is roughly 10 minutes of conversation, 5 minutes of questions, but the presenters are entitled to use the full 15 minutes just to present if they wish. After the 3 different presenters have concluded, we'll move into an open Q&A, which will last until 1:50 or whenever we have asked our questions. But if experience is anything to go by, we'll run up to the end. There'll be plenty of questions following this very interesting set of presentations. Okay. Some brief housekeeping for everybody, please. If you wouldn't mind keeping your microphones and cameras off until discussion time or when it's questions and answers time. 1 or 2 cameras are on, or sorry, one or two microphones are on in the background. We can hear people. I'm not sure if they realize that. If you wouldn't mind using the chat primarily to ask questions, please. But if you feel like you cannot get your question in the chat, then you can raise your hand. If it's a complex question, you're welcome to come on camera or microphone and ask your question that way. If it suits you better, The event is being recorded, and so if anybody has an objection to that, you're welcome to withdraw from the live event, and you're welcome to watch the recording. The recording of the event will be shared with everybody who has signed up. Okay. Oh, there we go. Now, just to share some exciting news that was shared with me earlier this morning before I go on to introduce briefly the presenters and their talks. Ella Jackman, who's one of our amazing assistants here at the Community of Practice, shared some figures with me earlier I'd like to share with people. We have 94 registrations for today's event. We have 50 people here live right now. In our experience, people drop in and drop out of these events according to their work schedules, but 94 registrations means 94 people want to see the recording, which came off the back of 344 registration page views. So that's a 28% registration rate, which is phenomenal. But more than that, the Community of Practice has added 55 new members, which takes us very close to 300 total membership, which is a very symbolic and important figure. And I would say, you know, a figure that we would have only hoped for maybe a year or two ago, but it shows the amazing work that the Community of Practice is doing. And by the Community of Practice, I mean all of us. I mean those of us that lead it, those of us that do the back end, those of us in the advisory group, our presenters, our audience, our participants, everybody who's involved in the conversation makes up the Community of Practice. So this is a really big thing for all of us, and I'm delighted to share that. Just a quick distribution of where people are watching from today. We have 14 people registered from universities and educational institutes. We have 35 registrations from the Queensland government, both state and local government levels. We have 11 nonprofits and advocacy groups. We have 5 people registered from the private sector and 2 registered as others. So quite a nice distribution across the audience here today, and also reflective of the distribution of membership of the Community of Practice. Wonderful. Very briefly, just to move on, and I'll be finished. I'm the co-lead and chair of today's meeting, Dr. Tony Matthews. I'm an urban and environmental planner with a long history of interest in environmental health and environmental design for good health. Associate Professor Shannon Rutherford, who's also on camera, is the co-lead of the Community of Practice. Shannon has a background in environmental science and is currently part of the School of Public Health at Griffith, and has a very, very long and illustrious career leading projects at both the national and international scale. So we're very happy to lead the Community of Practice, but we're very capably assisted along the way, I can assure you. I will let every presenter today take a moment to introduce themselves more properly than I can. But first up, you can see we'll be hearing from Luke. Luke Reid is the president of the Energetic Communities Association. I've known Luke for a long time. He's a great guy, and I'm very excited to have him present today. He'll be up first. Following Luke will be Monique Monti, as well as Christabel Carvalth, both of whom will be presenting together. And they'll be presenting on concession card opportunities for vulnerable populations and a few other things. So we're very happy to get their input, and they both have long and varied and decorated careers in their fields. Very exciting to have them along. And finally, Dr. Nicole Sleeman, who will be presenting. And Nicole is a long-term member of the Queensland Heat Health Community of Practice, and somebody who's been a supporter of ours for a long time. And we're delighted to have her come along today and present her work. And Nicole will be presenting her work on what's going on in the health sector broadly around heat and heat management. And what's interesting particularly about Nicole's portfolio, she's based in far north Queensland. So we'll be very interested to get a perspective from up there in the tropics. So I will leave it there. I'm going to hand over to Luke now. I'll keep to time. It's 12:37, Luke, as we start. So I'll let you know when you have 3 minutes left, let's say, and you can start wrapping it up. If you finish after the 10, please, we can switch over to Q&A, but go to the 15 if you need to. We will always have the opportunity for Q&A at the end. Thank you, Luke.
I think I'll be used to this now. Thank you very much. Tony, am I to control the slides, or will someone change them for me? Okay. I think I can do both. Yep, great. So yeah, thank you, everyone. My name is Luke Reid from Energetic Communities. And I'd like to thank the Community of Practice for having me today. I think you guys are doing great work. So I'm going to talk about the lived experience of renters in the energy space, the housing space and heat. And talk a little bit about some of the programs we're working on. But first of all, I'd also like to acknowledge the Yagara and Turrbal people on whose land we stand in Macanjin or Brisbane. and acknowledge their leaders past and present. So who are we? We're a small not-for-profit. There's only 4 or 5 of us. We initially started to develop community energy, but we learned very quickly that the energy system we have is not really designed for people, especially at-risk people made vulnerable. So we got heavily into advocacy, and we advocate mostly for renters, but for all households and community organisations. And we do a couple of things around livable homes for all and energy literacy. If you're a renter, I encourage you to go to our website. I'll share the site soon, but you can do a renter survey because one thing are missing is data. So I'm going to cover quite a bit of ground. I sort of am aware I'm followed by some health professionals, so feeling a bit inadequate. I won't go into too much detail around the health. But some of the key messages I want to share are that we know that heat kills more people than any other disaster and climatic event. In fact, it kills more people in Australia than most disasters put together. We know it disproportionately affects marginalised communities and most vulnerable populations, including renters. And we know that this occurs mostly in the homes and work sites. So we need more efficient and housing design and upgrades for the environment, affordability, health and climate resilience. We also know that renters and low-income households live in the poorest quality housing. They have the least agency to act, and we need a systems approach. So we need rules and regulations to encourage landlords to upgrade their homes and provide a healthy, affordable home. And to do this, we need minimum energy efficiency standards and upgrades. From a climate point of view, at the other end, we're currently at about 1.5 degrees, but we know in our current trajectories, we're going to be somewhere a little bit above 2 degrees if we don't do a lot more. And that means we're going to have a lot more heat waves, and they're going to be lasting for longer. So this slide is one of the key slides. You can see this diagram on the left. It shows you the amount of people dying from heat compared to other climatic events. And put this into context, that's around just under 3,700 deaths a year. In 2023, there's just under 1,300 road deaths. So the heat deaths is almost 3 times as many. At the other end, when we talk about housing, we strongly believe at energetic communities, everyone has a right to a climate safe, efficient, healthy, affordable and comfortable home. And that's everyone, not just those who can afford it. So we currently have around 2 million houses in Queensland. And we have the nationwide house energy rating scheme, which rates houses from 1 to 10 stars, representing how much energy and the cost of keeping the home comfortable. New homes from 2022 must be 7 stars, but existing homes, that's homes from pre-2003, when this rating scheme became mandatory for new homes, don't have that requirement. And it's estimated that those homes average on about 1.8 stars, and there's no requirement to disclose what that rating is. So it's a two-ended candle. We've got climate change and we've got poor quality homes. So we need to make sure the homes that we do build and upgrade are heat resilient, and we need to stop approving fossil fuel projects. And we need to increase access to renewables for households. This came from a study in 2019 from the Queensland Fire Emergency Service. I'm guessing many in this audience will know this, but it just shows you really on the left that we've had a slight increase in heat wave in the last decade. But as we go forward through this century, we're going to have significantly more hot weather. We're going to have more heat waves and maximum annual heat waves, so that's above 35 degrees. This means we're going to have more demand for cooling our homes. But the key point here is that a 6-star rating today, recognising this was actually back in 2021, a 6-star rating today is going to drop to only 5 stars by 2030. And in the worst case scenario, Queensland houses are going to be only 1 star. So that means they're going to be harder to cool, and it's going to be harder to minimise energy bills and improve comfort. So we need to make sure we keep improving our housing standard. What does this look like on the ground? So the World Health Organization have a standard saying there's no demonstrable risk to human health of healthy sedentary people living in an air temperature of 18 to 24 degrees. And note the word healthy. So there are people at more risk at those temperatures. To this end, Better Renting did a study, and this is one of several studies, some are 2 years ago, and they found that of the houses studied, all were above 25 degrees for 86% of the time. Some were above 30 degrees for 5 hours a day, and the average temperature was 27.6 degrees. So as a result of these sort of impacts, we got funding to run Livable Homes for All, acknowledging that Queensland houses renters are missing out on the energy efficiency. Landlords have no price signal, regulation or incentive to improve energy performance of their properties. And even when they've been offered free upgrades, most of the time they say no. And that renters often face higher relative energy costs. We also know that over a third of renters, Queenslanders rent, and that proportion is increasing. We also know that many households, rental households, are low income. They live in poor quality homes, and especially in remote and Indigenous communities. And those poor quality homes lead to health impacts, high running costs, bill shock and debt, and poor climate resilience. So what we're asking for is Queensland Government to introduce energy efficiency minimum standards for rental properties and to commit to progressive improvement over time. So this is also a national campaign, the Healthy Homes for Renters, and there is a community sector blueprint on what we think this should look like. So what are these standards? There's two main types: performance-based, so 4, 5 or 6 star for the whole home, or features-based. That's where we're saying every house must have a heater or an aircon of a particular rating. Victoria has 2-star heaters, or say ceiling insulation or shade or ventilation, etc. Can be a hybrid as well. So what we're asking for is features-based with a independent third-party assessor, so not the real estate industry. We want more flexible. This will offer more flexibility for building types and climate zones, which are quite broad in Queensland. More flexible actions to achieve that standard, and to target poorest quality homes. This also needs mandatory disclosure. So this is where we have a rating or certificate by that third party, and it's represented at the time of advertising or sale for house purchasing, but also to give owners and agents time to adapt to the new scheme. And this already occurs in the ACT, and New South Wales is committed to it. So where are we now? We're not doing too well in Queensland. We have no requirement for insulation, no requirement for ceiling fans or fly screens, no requirement for draft proofing, no requirement for heating or cooling appliances, and no requirement for efficient hot water or lighting. In 2017, there was a review of the Housing Act for Queensland. So this is the act that represents rental rights. And in that, it was argued that these upgrades would be prohibitive for property owners, and we think that's a valid concern. But we also acknowledge that it's a transfer of wealth, because if we don't do this, then tenants living in poor quality housing end up paying more to keep it cool, paying more to keep it warm in winter. And then they also end up with health access. They can't access emission reduction, and there's safety concerns. And it was also argued that we can't bring those existing poor quality homes at 1.8 stars up to the National Construction Code standard. But no one was actually arguing for that, as far as I know. And it shows you on the right that after a certain point, the benefit kind of plateaus off a bit. And when we know that the poorest quality homes are the majority of homes, then those big wins are just raising it 1, 2 or 3 stars. And the final piece, like I think I'm already at 10 minutes. The final piece is just wanted to talk about a program we're running. So we're actually running 2 programs on energy literacy, one working in partnership with Tenants Queensland, called Empowering Renters, and one in partnership with QCOS, Queensland Council of Social Service and Neighbourhood Centres. These are funded from the Energy and Jobs Plan. We're still waiting for the current Labor LNP government to produce a plan to know what their policy is in this space. But there are 6 or 7 programs, under this program. And our model is a train-the-trainer model. We've trained 8 community workers from Tenants Queensland and 20 from neighbourhood centres to work with their cohort, their clients, to understand the energy system and how it impacts them. This is just a screen grab of our landing page for the Empowering Renters project. If you're a renter, you can book a phone call to find out how they can help you. get a session for your community group or your household. And if there's resources, you can get a home visit. So you can just contact them through that orange button there. And I think it's quite a good program. We've got some good responses from this program. So what does it look like? High level, we've trained community workers to understand the big picture around what the energy transition is, why we need it, and how it's impacting households, but more importantly, who's missing out and why. Module 2, which is where the heat comes in, we help them understand what the well-being is. So this is through energy poverty, can be through mold, etc. But obviously heat is a big part of that. Module 3 is where the rubber hits the road a bit around bills, concessions and rebates and tariffs. Module 4 is also around the heat and around energy efficiency and how they link. Module 5 is around the shiny things, solar and batteries and all the things that often renters can't access. And Module 6 is around the broad mis and disinformation that we see. I'll just say that all of these resources are freely accessible on our website on our deep dive resources page. So what do we actually work with? So we help the community workers understand what it is we need in the transition to make sure houses are healthy and climate resilient. We help them understand what the energy services are, what energy poverty looks like, who's affected and why, and how to improve their situation, how to improve energy efficiency, how to understand energy versus health and comfort impacts. So what are the temperature impacts, the humidity, mold and who's responsible, and gas and when it's a bad thing. So spoiler alert, pretty much all the time because it leaks and emits greenhouse gases. And of course we go into climate resilience and grid resilience. So there was an article about 2 years ago. Imagine if all Australian homes were fit for purpose, healthy, affordable to run and climate resilient. Imagine if all Australian homes were energy efficient. This is the housing we need, but for many it's not what we have and nor is it the housing we're building. So part of this, we work with the community sector to understand energy efficiency more broadly, in particular around resilience to climate change and affordability. So what does this look like? We help them understand the benefit of energy efficiency. We can't just whack solar and energy and even efficient, aircon on the homes because aircons run when solar doesn't. If you don't have batteries, don't have an energy efficient home, it actually becomes really expensive. And a lot of people don't actually use the aircon that they do have. So the things we cover is how to lower energy bills, how to improve comfort in the home, how to improve mental and physical health of the householders, how to make sure homes are climate resilient, how to reduce emissions. The interesting one is around employment, around energy upgrade programs. So that's probably the next phase we're going to see, and how it supports the energy system. So that's me. Open to questions. I know we've only got a few minutes, but I do encourage renters to go on our website, do the survey, and for everyone else to have a look at the bottom 2 websites there and how you can access these programs. So thank you very much.
Amazing. Thank you, Luke. We've gone right up to time, but maybe if there's one quick question, we'll squeeze it in before we move on. Is there any quick questions jumping out? Lots of hand claps, Luke.
Thank you.
Lots of people appreciated your talk, but maybe they're formulating their questions. Okay, look, I think we'll move on. We can come back to Luke at the end. We have a long Q&A where we can engage with all the presenters. So I think we'll say thank you for now, Luke, and we look forward to chatting with you some more in a while. Moving on, next we have Monique Monty and Christabel Carvall from the Department of Family, Seniors, Disability Services and Child Safety, and they'll be co-presenting on concession card schemes benefiting cards and concessions in a heat health context. So this is going to be quite an interesting one and a new topic for us here at the Community Practice, and we're very much looking forward to this. So thank you both, and I'll hand over.
Thank you very much, and thanks for the invite. And Luke, that was an excellent presentation. My name's Monique Monte, so I'm the manager with Seniors and Carers within the Department of Family, Seniors, Disability Services and Child Safety. And with me today is Christabel, and we oversee a range of policy and programs for seniors and carers, which include our cards and concessions, but also our elder abuse prevention services and senior social isolation services. We're also joined by Tiona, who's from Smart Service Queensland, and they're responsible and our business partners for administering our concessions scheme. So the Queensland Government is committed to creating an age-friendly community where our programs and policies help us as we age. In 2022, the Queensland Government became an affiliate member of the WHO Global Network of Age-Friendly Cities and Communities, and our department oversees that on behalf of that government. As part of that as well, we understand that we've got a rapidly growing ageing population, and it's expected that by 2053 there will be over 1.7 million older Queenslanders aged over 65, and implementing age-friendly strategies and actions is more important than ever. That's why in 2024, the Queensland Government launched our Age-Friendly Queensland, the Queensland Senior Strategy, and accompanying that was an action plan for 24 to 26. It includes 51 actions across 16 government departments, and some of those actions include the Get Ready Queensland program, which builds resilience in disaster management and heat waves, as well as we have a program to promote cards and services for older people through information and support sessions run through our Seniors Expo program. As part of our funding programs, we also run a seniors peak body, and that's Council on the Ageing Queensland, and they're currently running what we call the Energy for Seniors program funded by Department of Energy. And that's a statewide community education program to help empower older Queenslanders through face-to-face discussions to talk about energy bill and how to raise awareness of available concessions. It also gives people in the older community a better understanding of how to read their energy bills and better confidence to manage energy efficiency in their homes. I'll now hand over to Christabel, who talks more specifically around our concessions.
Yeah, thanks, Monique. This first one is probably our concession that is most closely aligned when looking at heat health. So it's the medical cooling and heating electricity concession scheme. And it's for people who have chronic conditions that are aggravated and made significantly worse by changes in temperature. And it assists recipients with just around $500 per year, and that's paid directly into their bank accounts on a quarterly timeframe. So to be eligible for this concession, the applicant must be a Queensland resident and assessed for low income. So what's looked at there is if they have a Centrelink or Department of Veterans Affairs pension concession card, or a current healthcare card from the Commonwealth Government. And they must have a condition where cooling or heating is significantly made worse by changes in temperature. The application form does have a number of examples of types of eligible conditions, such as multiple sclerosis, significant burns, loss of skin integrity and sweating capacity, but that's not exhaustive. There's a section on the application for a medical specialist to complete, and it's up to the medical specialist to determine and complete that section of the form. Sorry, I'm still on. I just thought just run through those last couple of points. So people must have an air conditioning unit or heating unit, depending on what their condition is, in their home, and be responsible for paying their electricity bill. And the form can be downloaded or and sent back via email or mail, or people can call the phone number there to get a paper application of the form. Thank you. Next slide. We also have a number of other concession and card schemes that I just thought I'd run over. So people might be eligible for these as well as the medical cooling and heating concession, or if they're not eligible for those, these might assist with, costs of energy and other costs. So the electricity and gas rebate provides, electricity is $372 a year and gas is $89 a year. And eligibility for those are that People have a pension concession card, again, from either Centrelink or DVA. Seniors card holders are eligible, healthcare card holders, and also IMI card holders, so people seeking refugee status. And to apply for those concessions, people contact their energy provider. So for the majority of Queenslanders, that would be sort of, your known energy providers like AGL or Origin, who you get your bill from. There are some places in Queensland like caravan parks or multi-unit dwellings where their electricity is from one sole provider. So the person would contact the person that gives the energy bill, provided that their energy is individually metered for their residents. The Home Energy Emergency Assistance Scheme is for people who are having trouble paying their energy bills and have had a unforeseen emergency or short-term financial crisis in the last 12 months. And it pays up to $720 once in a 2-year period. And again, people would contact their energy retailer or whoever provides their energy bill to access that, again, if their energy is individually metered. And we do acknowledge that that is one of the issues in accessing some of these schemes. The next one is the electricity life support. I guess it's sort of a much narrower part of the Queensland population, but still really helpful for those who have a serious life-threatening illness where they're on an oxygen concentrator or a kidney dialysis in their home, and the applicant must be assessed by Queensland Health Medical Aid Subsidy Scheme, and through that assessment they get given the application form, so that's quite streamlined that people find out about it. And we also have a number of card schemes which can, I guess, provide assistance with savings and benefits and concessions. So the seniors card is available to seniors who are aged over 65, working less than 35 hours a week, and are a Queensland resident. I might have just said that. It's also available to those aged 60 to 64, working less than 35 hours a week, who have a pension concession card or a similar card. We can send through links with details to be circulated to those who have registered for the session. And the Seniors Business Discount Card is available to all Queensland residents aged over 60. So both those types of card holders can access discounts at over 6,000 business outlets throughout Queensland. And from a heat health lens, the types of things that people might want to access is things like an electrician to install, air conditioning, purchase of an air conditioning unit, window glazing, window tinting, curtains, insulation, that type of stuff. There's also a senior shopper that people can access, which also, will put out to a number of businesses and get the most competitive price. So, and I don't have listed here, but we do have a carer business discount scheme, which has a lot of the similar businesses. So acknowledging that carers out there who receive a carer allowance or carer payment, they can also access some of those business discounts, which might help manage heat in this current context. The companion card is for people with disability who have a lifelong need for attendant care support to get out and about in the community. And there are business affiliates that offer 2-for-1 ticketing. So if a person with a disability, is sort of sick of going to their library and their shopping centre and they want to go to the movies, it just makes it a little bit more affordable. The person with the disability would buy a ticket and their companion gets a free ticket. So there's a range of businesses like sporting events. You can go to a play or movies or yeah.
I'm on the H2 podcast.
We've got some feedback there.
But that was basically the end of.
And look, we recognise that a lot of age-friendly practices don't have to be costly. For example, a lot of our councils do some great work in terms of arranging community events, also considering like cool spaces, making sure that when they're developing the infrastructure for their local community, having bus shelters that are covered, plenty of green spaces as well, and access to areas. So in Victoria, for example, they've done a great piece of work where they've mapped all the cool places that someone can go in those hot days if they can't get out of the heat. So thank you.
Wonderful. Thank you both. That was very interesting and informative and very practical as well. Thank you both so much. Not sure how much people knew about those schemes. I only knew about one or two of them in all honesty. And we have a few minutes for questions if there are any from Monique and Christabel. If anyone has a question ready, we have time to fit them in. You can either drop it in the chat or please put your hand up and you can come on the mic. Shannon, you have a question. And also who's
Monique.
we also have a question from Monique Lewis from Griffith. Yeah, so 2 Griffith questions. Let's do it.
Just thank you so much, guys. And I guess following up from Tony's point, I guess 2 questions. Is there a navigation panel on your website? So this is all in one place. So an individual who goes here can easily work it through, or their carer. I'm seeing nodding.
That's correct. So we do have the seniors page and we can send a link to that, which gives the details of all the different cards and concessions. But for anyone who also struggles with the online, they can also call QGov on 300 QGov and they can assist as well. So we have both options available to people.
And for concessions, there's also the Queensland Savers website. We can send through the links and people can put in, you know, what their age is, whether they're renting or, you know, if they're looking for health type concessions, and then it will give a list of concessions that they can look into whether they're eligible. Yeah.
So Tiana's just put the link in now for the Queensland Saver.
Oh, thanks.
That people can access. And then for the Queensland, like the business discount, there is a search functionality. So you can put in electrician or solar or insulation and it will bring up the businesses that offer those discounts.
And the second question is, do these have caps on them? And do they ever get close to meeting their caps?
So the medical heating and cooling does not, and nor does the home energy emergency, or the home energy emergency does at this time. We haven't reached the cap or anywhere near close to the budget for medical cooling and heating, but we do suspect that in the next 12 months that we're going to see an increase in home energy emergency scheme with more people having to access it with cost of living support not as great. So,
super. And we've got Nick Sleeman talking a bit more about healthcare in a minute. So it'd be interesting to know from a health professional perspective, how many, you know, health professionals being asked to fill these forms in, and do they even know to refer their clients to doing this? So that'd be an important discussion. So thank you.
Thanks, Shannon. Monique Lewis had a question, the other Monique, and after that we might move to Nicole Sleeman, Dr. Nicole Sleeman, just to keep on time. But Monique, if you want to jump in with your question, delighted to hear it.
Yes, it's just a quick one. And thank you so much, Christabel, Monique, and to Luke for those presentations. Really good to hear about what sort of programs are out there happening, this really important work. My question is fairly simple, and it kind of was triggered by Luke. Is there anyone putting pressure on landlords to take responsibility for installing things like ceiling fans, air conditioners as a bare minimum?
Not to our knowledge, and that would be a question primarily that would be managed by Department of Housing. But I don't know if Luke can answer any further of what he's seeing in that space.
Yeah, there's lots of pressure on the state governments to do something, but we're only seeing it in New South Wales, Victoria and ACT, where they already have minimum standards. And we are waiting on state government to announce a solar for renters program. But in terms of things like air conditioners, insulation and shading, these are the things we need to see. In other jurisdictions, like in New Zealand, landlords actually get fined and the money goes to the tenants if the landlord doesn't do this. So we are way behind in Australia.
Yeah, what a great initiative New Zealand's got going. Fantastic. Yeah, and they always seems to be a group that get very protected at election time in that discourse as well, the landlords. But that's enough from me. Thank you.
Super, thank you. Actually, look, there is one more question. If we have time to slip it in, which I think we do, from Tom Hullett. You have your hand up, so if you want to come on, Tom, and ask your question again, delighted to get that.
Yes, thank you. I'm coming through.
Yeah, you are.
Okay, great. Thank you. I'm interested. The emphasis in that last report was the multiplicity of small allocations that are available in this age of clever computers and AI and whatever. Is it not possible for the government side to present an automatic and somebody fills out the initial this is me and this is my condition, that they are then automatically given a list? Do you know you qualify A, B, C, D, and each of those, press this button and we will automatically put you through. Now, instead of that, the person has to think, I'm disabled, I'm aged, but I have to somehow work out, now I've got to contact that person and that might give me, whatever amount of money, and anything is acceptable, of course. But it seems to be very much in terms of protecting the budget. That comment just made, no, we haven't overspent our budget at all. Might I suggest that a different approach, rather than look at, the landlord needs a kick in the pants, and most of them do. But the reality is there's a lot more that can be done by, for example, the guys who are reporting today. So very supportive of what you're doing. Please don't misrepresent that. But it just seems to be we're doing so little in terms of saying, hey, we'll automatically connect you up, not hunt down these people, even though you may not have the ability to do so. But if you do, thank you.
Thank you. And look, I mean, that can be quite a complex question, and I understand that would be incredibly beneficial. We are definitely looking at upgrading systems and support ways to be able to keep people in the loop and be able to apply. But we're also mindful that in the age of AI, but also in terms of privacy and confidentiality, there is some difficulties with sharing information between departments and people having to provide that consent process and understand that process. So there's a lot to navigate in that. It requires complex legal advice, privacy principles. It's a real hard one.
There has been some work done by the Digital Lead Queensland Government Department on that, but it presented, once you logged in, and it did require people to do that process of logging in. If they had done different transactions with Queensland Government, then it would provide tailored information to that person. And I guess, we're just on a journey of trying to become more mature in that space while, balancing those.
And we're also seeing a lot of schemes. So just for example, in the MyGov scheme with Centrelink, unfortunately, more people are being targeted through those online portals. So it can be quite complex.
Thank you both for taking on those questions, and thank you to the questioners for their excellent questions. Thank you, Tom, for that one. It's kind of an interesting idea, and I think we all feel that with government services, but it's not always easy to make it easier, as Monique and Christabel have noted. But wonderful to get that information, and thank you both so much. Okay, in the interest of keeping the time and having sufficient time for a Q&A afterwards, I think we should move directly to Dr. Nicole Sleeman. Ella, if you'd like to put the slides up again. And Nicole is welcome to take over. Now, Nicole, I think you joined a little after I gave you a brief introduction earlier. So if you would like to introduce yourself at the top of your presentation, please do feel free to do so, and give us some background on your work and professional interests. And I'll leave it there. Thank you so much.
Can you hear me okay? Yeah, great. Okay.
You're coming through fine.
Excellent, great. So I'm Nicole. I'm a GP up in Far North Queensland in Cairns, and I became involved and interested and involved in climate change and health back in 2017 when I was alerted to the organisation Doctors for the Environment Australia. I went along to one of their conferences, and I learnt just how urgent action on climate was for the sake of human health. And I've since been really heavily involved in climate health activism and advocacy and campaigning. And yes, I've completed some further study in climate change and health. and was really flattered to be asked to present this talk today, and have researched as much as I could to try and give an accurate picture of what's happening in primary care in Queensland, which reflects some of the rest of the country, but trying to focus on Queensland in responding to extreme heat as temperatures rise. So just starting, okay, so this is from the National Health and Climate Strategy, which was published in 2023 by the Department of Health and Aged Care. And I've put out two really important quotes. The first one is that heat is one of the most significant climate risks to health and well-being in Australia, and that heat waves already cause more deaths than any other natural hazard, and that the health risks associated with heat exposure will increase as temperatures rise, as our population ages, and as more people in Australia live and work in urban centres. And also that exposure to both extreme heat events, being heat waves, and to incremental increases in heat overall are associated with increased morbidity, which means illness, and mortality, deaths. Next. So everyone is at risk of heat-related illness. However, there are groups in our community who we identify as being at higher risk, and they're listed here. And just to highlight, I realised when I was putting this talk together that in any one day in general practice, a GP practice will see several individuals from these high-risk groups. So really, we're faced with people who are high risk on a daily basis in primary care. Next. So our health sector is also at risk in the face of increasing temperatures. We know that in emergency departments, they see higher volumes of patients requiring higher levels of care during heat waves, and also higher rates of mental health related visits to the emergency departments too. Next. Data has also shown that heat waves have led to a 5% increase in deaths varying across Queensland. So we have some state-specific data there reflecting the impact of heat waves on deaths. Next. So this study looked at ambulance call-outs in Queensland during heat waves between 2010 and 2019. And what it showed, next please, was that there was a 12.68% increase in ambulance calls during heat waves compared to on regular days. But interestingly, 22% of these call-outs were during low-intensity heat waves, while only 1.16% of call-outs were during extreme heat waves. And so it's likely that one key reason that low severity heat waves have a greater impact on ambulance calls is because people underestimate their risk of heat illness, and therefore they don't modify their behaviour until temperatures become more extreme. Also, as you can see here, this is from Queensland Health's Heatwave Health Warning and Messaging Guide, and heatwave messaging increases as heat waves become more severe, which places the focus on extreme heat rather than the risks of overall increases in temperature. And so this is obviously at odds with the data, which is telling us that there are more ambulance call-outs during low intensity heat waves. And this doesn't mean that this messaging or comm strategy is wrong or not doing a really important job, but it does tell us that perhaps we need to be thinking more broadly and strategically about how to effectively support our communities to reduce their risk of heat-related illness and death, including addressing the significant risks of low-intensity heat waves. Now, it's also unknown as to how many people in at-risk groups receive these heatwave alerts. And as I was thinking about this, putting this together, I reflected on my 83-year-old stepfather, who isn't on any social media following Queensland Health, and he largely relies on commercial TV news to get his updates on the weather. He also doesn't understand that he's at high risk in the face of increasing temperatures, and he's a really good example of many members in our community that are in exactly the same boat. Next. So this graphic is from the National Health and Climate Strategy that I've quoted at the beginning of this presentation, and it proposes different measures that could be considered to reduce risks to health from heat. And one important quote I've pulled out is that many of the adverse health impacts of heat can be minimised or prevented with well-designed adaptation interventions. Next. So in Queensland, as I'm sure some of you know on the call, Queensland Health is the primary agency responsible for the hazard of heat wave, and this is largely, rather than adaptation and prevention, it's through the disaster management team. So that leads us to think about what is the role of primary care in reducing heat-related illness and deaths in our community. So this study, done by some of the wonderful people at QCOP towards improvement of heatwave warning for older adults, tells us that there is evidence that our own perception of heat risk correlates with the adoption of heat-safe behaviours. And we know that many people underestimate their risk, or they don't realise that they're at risk at all. And what's more, population level warnings and heat health messages are not as effective as individualised messaging in changing anyone's perception of their heat risk. And so those individual heat conversations and individual counselling around heat risk for high risk groups to understand risk and then facilitate those heat safe behaviours is really crucial to improve outcomes. Next. So this data is from the Australian Bureau of Statistics, and it tells us that people have more contact with GPs than anyone else in the health sector. So GPs are the blue columns, the light blue columns. And this data only shows GPs. It doesn't include all the nurses in the community, allied health professionals and pharmacists who also make up the primary care sector. So it would make sense that the primary care sector is really, really key in working to reduce heat-related illness and death in our communities, because we have more contact with the community and with at-risk groups, and because individualised messaging is so much more effective for accurate risk perception and behaviour change than the population level warnings. And so to reduce harms of low intensity heat waves, we really need to be preventing the harms in the first place. So then I had to look at what is already happening in primary care in terms of heat waves and heat adaptation. So we have some available resources. This is an educational article from the Royal Australian College of General Practitioners, and it was published at the beginning of this year. However, I note that only GPs would be reading this and not nurses, allied health and pharmacists in the primary care sector. We also have some guidance from the Queensland Health Heatwave Management Subplan, and this is a fantastic checklist for GPs and GP practices to guide us in heat adaptation. But admittedly, I didn't know this existed until I started to put together this talk. And while I can't speak for all GPs, I do suspect that many others in the community also don't know about this plan and guide. And we have posters for waiting rooms. Once again, I'm not sure that these are very widely used. So available resources don't always translate to action on the ground. And so when I was asked to prepare this talk, I decided to do some little bit of research and ask some colleagues here in Cairns who are all working at different practices about heat adaptation in their clinical work. And while this is only a small sample of GPs, I think the information I received has been really insightful in terms of getting a feel for what is and isn't happening in general practice regarding heat health. The first person said, I have heard of resources and seen the odd thing. There should be a lot more, but I would love to have both more specific evidence-based info at general practices in newsletters or alerts, but also to councils, organisations and schools. Next. The next said, I don't actively consider heat risk in practice. I don't think I give it enough thought as a risk factor. The next, we have not had significant movement in the ARCHO space regarding heat, which is the Aboriginal Community Controlled Health Organisation space that I'm aware of. And I think it's difficult for GPs to fit this topic into their already crowded conversations. I rarely cover this important issue. I think it's fair to say most GPs don't realise that heat is such a big killer. And lastly, from another ARCHO, as part of our health assessments, we include a large section on social elements such as overcrowding, access to power, running water and refrigeration. We don't specifically address heat risk. We provide water and assistance as required during heat waves, but this is quite intensive and at least in part a bit reactionary to the event itself without any major planning or formalised heat assessments. And so that reflected to me the fact that there's probably not much happening in the way of heat adaptation on the ground, in general practice at least. So then I thought, well, what would heat adaptation look like ideally in primary care? And this is what I've come up with. So identifying risk is the first step, and GPs need both adequate education to be up to date on heat-related risks and then be supported by systems that enable the efficient risk assessment and response. And maybe this looks like an online assessment tool that pops up when people book online, or a risk assessment tool in practice software that can be performed efficiently during consults, and then readily available resources to provide patients with at that same consult. Helping individuals to truly understand their risk requires, again, practitioner knowledge and the time and resources to pass on this knowledge effectively. And I know that GPs are already overwhelmed by too many issues and under-resourced to respond to them all. People need access to easy and appropriate information on cooling strategies. And I say appropriate because if you don't have aircon at home or the funds to pay for a big energy bill, then this needs to be taken into consideration when you're being counselled on cooling strategies. Both practice and personalised heat action plans need to be integrated into primary care, and one way of beginning this is to routinely include them in chronic disease management, and active support from PHNs could help GP practices institute practice heat action plans. Medication changes are very important for some people during extreme heat, and they should be part of individualised action plans. And home medication reviews by pharmacists is one way this could be done, and pharmacists could have those heat risk conversations with patients at those times, as well as advising on how best to store medications in rising temperatures. We need easy access to heat health resources for patients, and noting that at-risk groups such as older people may not be receiving current heatwave communications, I think there's scope for primary care to amplify heat communications. And lastly, primary care can engage with the community outside of consult rooms. We can be educating and advocating to people not trained in health in our communities who are in positions to both raise awareness of heat risk and make decisions that reduce heat illness and mortality. In the case, for example, of local council, by healthy urban planning, including maintaining trees and green spaces and limiting development in line with good public health practice. So when I surveyed my colleagues, I went on to ask what they thought was needed for GPs to be better resourced in heat adaptation. And these are some of the responses I had. So practices could be supported by the Public Health Unit and PHNs in sending alerts to at-risk patients during these times. Alerts should contain links to appropriate information to support and advise patients about actions they should take. Maybe it could be included in the Red Book, Preventative Health Activities, which is our RACGP guide that supports us. I would be more likely to include it in my health checks as a discussion point. I would expect to be receiving support from RACGP, ACRM, PHNs, the Queensland Government, and also want to see it in the curriculum of medical schools. Home medication reviews by pharmacists are a great way to help develop heat medication action plans and educate people on their risk. What about more pharmacists in general practices? And I'd love to see a well-planned strategic campaign on heat safety delivered across Queensland with input from all parts of the health sector. GPs see the needs in our community in every consult, and we specialise in primary and secondary prevention. We need to be at the table in the development of heat adaptation plans.
Sorry to jump in, Nicole, but sorry to jump in, Nicole. This is fascinating, but just to ask you to wrap it up in the next minute or two, if you wouldn't mind, just so we have time for a proper Q&A. If you want to jump to your conclusions, please feel free, or take it however you will. But yeah, we'll need to.
Sure. I just got 4 slides on things that are happening elsewhere. So some education in New South Wales, some heat health tracking in New South Wales as well. Heat Watch, which is a web-based app, which I know GPs in New South Wales use, and also some fantastic cross-sector collaboration in New South Wales as well between the health sector and councils and community organisations. So the conclusions that I've come to in putting together this presentation, which are more intended as food for thought, is that firstly, heat kills more Australians than all natural hazards combined, and heat deaths are grossly underreported. Climate change isn't going anywhere, temperatures are still rising, and we urgently need to step up in this space and advocate strongly for the support that is needed to protect the health of our communities. The second is thinking about disaster response versus heat adaptation and primary and secondary prevention. Heat waves become disasters when communities and response agencies like health services are unable to effectively respond or adapt to rising temperatures. And I really think communities need to understand heatwave risks, particularly low intensity heat waves, to avert heatwave disasters. The third is that primary care is key in reducing heat-related illness and death, because personalised risk assessments, accurate self-perception of risk, and appropriate strategies to reduce risk need to happen in communities to prevent heat-related illness and deaths. And we need to think about how we can do this, because GPs are already overrun. And I think beginning with PHNs, the RACGP, ACRM, Queensland Health and Public Health Units is a good way to start. And lastly, that heat adaptation requires collaboration both within sectors and across sectors, because we all have a part to play and we need to play together to meet this great challenge. And this is my initial brainstorm of things to consider moving forward. But thanks so much to QCOP for having me. It's been a pleasure to present.
Thank you, Nicole. That was great. That was really great. Thank you so much. And obviously the audience feels likewise. So really appreciate your time today. We have questions coming in fast, but there's a couple in the chat that I might start with. And then if you want to put up your hand for any of the three presenters or any of the four presenters, as it is, 3 talks, 4 presenters, invite the presenters to come back on camera if they'd like. But let's have a look at the chat first. Luke Reed, can you talk more about how Queensland compares with the rest of Australia? You got some thoughts on that?
Might have a couple of thoughts on it.
Only that.
So we've been working this space for a while. Before I worked at Energetic Communities, I was at QCOS, and we did a report around the lived experience of renters. And there's been a campaign, so some people on this call might know Healthy Homes for Renters, and it's basically a campaign to get energy efficiency minimum standards in all states and jurisdictions. Parallel to this, the then COAGDA, Council of Australian Governments, wanted to have a minimum standard for Australia that the states can implement in their own way, and they came up with a really bad one, and it hasn't gone anywhere. We're still waiting for it to be updated. But as a result, the community sector put together the community sector blueprint, and that is a standard that says this is what we think as a community sector from the lived experience of our cohort, what we think it looks like. So more directly in response to Diana's question is Victoria, New South Wales and ACT all have progressed a lot further than us. ACT, as I mentioned, has insulation standards. They also have mandatory disclosure. Victoria has heating in shared areas, and Tasmania have, from memory, heating one as well, but quite minimal. So other states have progressed, and New South Wales have announced that they're going to introduce the mandatory disclosure. So we actually have a law already that allows a minister to make a regulation for energy efficiency minimum standards in Queensland, but they've refused to do it. So Section 17A of the Residential Tenancies Rooming Accommodation Act says the minister can do this already. So there's nothing stopping the current minister, the housing minister, so Sam O'Connor, from actually implementing minimum standards in Queensland. It was reviewed, it was rejected, and we're disappointed that this was under Labor, of course, that it didn't progress. But the real opportunity is now that things are getting worse, and we have technologies around retrofits that could be implemented, could be targeting lower income households, that could change quite readily. So short answer is other states are doing better and Queensland can do a hell of a lot better.
Super. Thank you, Luke. Very informative. Really appreciate that. There was a sort of question came in for you, Nicole. Can you share the groups and resources that we might consider having engaged with our LDMGs and DDMGs to assist understanding of and promoting risk reduction strategies?
Yeah, I'd probably have to do a bit of a brainstorm, but my first thoughts are the RACGP has a climate and environmental medicine special interest group, which I'm a part of. And so I think working with that SIG group is a great idea. And then QCOP also are fantastic in this space. I think realistically, it's a new space. Like I said, none of my colleagues are really doing anything around this. So I don't think, other than a few resources, I don't think there's been much investment in how really solid kind of risk reduction strategies. But yeah, those two groups. Did you want me to answer the next one?
Yeah, you might as well jump to the next one, and then we got a hand up from Shannon Rutherford. We'll move to you then, Shannon. If you don't mind, Nicole, you could just go straight to the next one.
Yeah, so yes, definitely humidity is definitely an issue. I know that we're at higher risk up here because we have a higher heat index, so our temperatures might not get as high, even though they have been more recently, but they may be lower than other parts of the country. But humidity increases that inability for us to regulate our bodies because we can't have we have too much water in our skin to evaporate and cool us down. So that's definitely a really important thing. And while just talking about the BOM heatwave assessments as well, I think we don't think about the BOM gives us, you know, one temperature, but if you go into the middle of, you know, the city in Cairns, there's some places that don't have very many trees, there's lots of asphalt, and actually those temperatures are much higher than what the BOM might report. So I think it's a bit reductionist to just look at the BOM temperature and say, you know, it's a heat wave. It takes out the local factors. And when I say local, I don't just mean, you know, far north Queensland being more humid. I mean like a particular place in the city or in a school playground that, you know, doesn't have many trees or shade covering.
Awesome. Thank you very much. Shannon, your hand is up. I'm not sure who your question is for, but please ask it in your own time.
Thanks. I was just wanting to do a plug just for that issue around what local governments can or could be doing around heat risk reduction. Tony and I and Monique also on this call are part of a NEMA funded project, which will be starting very soon. That's looking at doing some work around risk reduction, what works, because we're now getting a lot more evidence from the Northern Hemisphere, but also increasingly across Australia, and doing some work with local government to better understand across the state what activities local governments are doing so that we can be developing better resources to support local governments with some of that evidence base developed as part of this project. So any local government on this call, we'll certainly be reaching out in due course to work with you and look for champions and where risk resilience is occurring, trying to better capture that and share that so that we can be collectively learning from each other. Thanks. Just a plug about that.
Oh, thanks, Shannon. Yeah, no, that's very appropriate and timely. We'll be starting that work next month, actually, and it's a 2-year duration. So we'll be looking forward to getting into that. Any more questions? Do we have just looking through the chat here. Seems to be a conversation between two people rather than any questions. Any further questions for the chat, or anyone would like to put their hand up? Luke, you have your hand up.
Yeah, just to answer, I'll respond to Shannon and to Angela Smith. There's this idea of a rate-based mechanism. So way back in 2015, we did some work with the Community Power Agency on a whole bunch of things. It's called Renewables for All. And we looked at what are called rate-based mechanisms. And my understanding is these are actually allowed in Queensland. And it's basically when council does rates, say council can fund you to do upgrades, and whether it's energy efficiency or solar or batteries, and they attach it to the rates rather than to the homeowner as an individual. So that means if you sell your home before you pay it off, then the new homeowner ends up paying off the rest and they get the benefit. It is targeted at homeowners, live-in homeowners, and it's actually mandated in some counties in the US. And they call it, I can't think, there's another name for it. But it does mean that you have lower costs and paid off through those differences. And so the council then needs to get funding from somewhere else, because once again, councils aren't necessarily funded to do it. And there is some work from ACOS, the Australian Council of Social Service, looking at some of those mechanisms. And my understanding is they've spoken to state government a bit about it. But that's just one of those options. And in Victoria, they have the greenhouse networks, kind of interestingly named Yaga Waga Saga and IAGA, which is a Northern Alliance for Greenhouse Action. And then they have the Central Victorian Alliance for Greenhouse Action. And these are alliances of local governments that work, and they've done some really good sort of heat mapping and really good work around some of that space. And just one other example is in the UK, the Roundtree Foundation have the Climate Just. I'll put the link in the chat. But it's working with local, with neighbourhood centres and community centres. So for you, Dr. Sleeman, I think would be really good to, having doctors involved in that and the Q-Heat around working with neighbourhood centres who are working with, that's where people go when things really hit the fan. They'll go to their local neighbourhood centre, often acting as resilience centres, and get all the services they can. And so they have a mapping thing where they map out who's vulnerable and who can help them. And it can be a really interesting tool. And we tried to recommend to the state government when I was at QCOS to do that, and fell upon deaf ears. But I think it's a really good program.
Wonderful, great information. Thank you, Luke. Really appreciate learning about that. And this is why we record these sessions, everybody, because there's so much information that you can always go back and double check this and follow up. Monique Lewis has a question. Has anyone explored or compiled the most effective and compelling storytelling techniques being used that have an impact on people's awareness and influence action around heat waves, e.g. a Sam the Seagull or Dumb Ways to Die campaign? Put that out to all the presenters. Anybody aware of anything in that space?
There was FNQ Rock, and there's someone, I think Maria's on here from FNQ Rock. They did one that I can't remember the name of, which was a kind of created images or characters talking about heat risk and illness. If you're on the call, Maria, you might be able to elaborate on that.
Hello, thank you. Yes, hello everyone. Maria from Far North Queensland Regional Organisation of Councils, and I was just pulling up an example of what it is that we did work on. We being 12 local councils that make up the Climate Resilience Technical Committee, along with other organisations, we developed a Keeping Our Cool toolkit, and the toolkit was designed to help councils and organisations to create strategies that will help build resilience to 6 vulnerable cohorts in Far North Queensland. So if it's all right, if I am able to share, I would love to just show you an example of one of the persona deck cards that we've got, just to give a bit of an idea visually of how you could use that to build a strategy, if that's all right. Oh, I don't think I can.
Are we set up, Ella? Are we set up for participants to share screen?
No, we're not. It doesn't look like it.
No, unfortunately not. Maria.
What I can do, just because it is a great resource, especially for building strategies, I'm just going to take a screenshot and I'll just put it in the chat, see if I can. Yes, I can. There we go. So this is just one example of 6 different personal deck cards that we've created. And the idea of this is to sort of help identify who the best community support people would be to send these messages to particular cohorts, what their needs would be, their goals, trying to get an understanding of what I guess what would be the best way to get these key messages and how to build resilience to heat waves to these particular vulnerable cohorts and these people. And we've also got ways to look at their behaviour change profile, how local, state, and I guess other organisations can work together and partner to be able to achieve this goal. So within this toolkit for councils, we created an action plan that aligned with the disaster management framework as well, along with resources on how they can include it in their social media channels. So I'm happy to share this toolkit with anyone. It's been really great. But anyway, thank you. I think that's enough of it.
Thank you, Maria.
Share.
That's great. Thank you so much. And I'm sure there'll be great interest in that. Shannon Rutherford put a hand right up. Was that to follow on from Maria, Shannon?
No, but I don't want to hog the floor. So I've just got another question. But great work. I'm really excited to see that work that Maria's doing.
Fantastic. Thank you. And just actually, while you're on there, didn't you guys do something a bit like this with the Ethos project? Wasn't there a series of videos produced?
Yes, we have produced a series of animated videos, particularly for older people, looking at trying to improve their risk perception about why their age makes them more at risk. So they're certainly available through our Ethos website. But thanks for asking, Tony. I guess it just brings me to the question I had is about there's a lot of great opportunities that have emerged even just today. But do people who need to hear them know where they are? And I guess that's the question is where do we collate this material and how can we better promote it so that it isn't hidden away, especially some of those subsidy schemes that could be kind of really directly benefiting people who need it most. Just a general question out there, I suppose.
Anyone want to step forward with comment on that?
I just have my hand up, but it's Michelle Thomas from Anglicare, and I just wanted to reiterate how awesome the Ethos project was in developing those small video clips. We used them all last year, and we had showed them to our staff. We actually used them in some of our lifestyles groups where the clients are coming into the centre. They were fantastic, and I can just say that they're short, they're sweet. They hit the mark, and it actually reminds everybody. So they're a wonderful tool, and we'll be using them again this year if we're allowed. But my perspective on this, and especially with the ageing populations or vulnerable populations, is that those particular resources really support us as a provider to do a better job at managing that, because there's so much stuff to juggle that if somebody else is creating things for us to use so simply and so easily to spread that word, it just makes it so much easier. So I just wanted to put my 2 cents in.
Thanks, Michelle. Really appreciate that. There's an interesting conversation as well happening in the chat for those that are reading it. I won't read it out to you. You can all read it for yourselves. And I see that Cairns is dealing with the same issues around urban trees that so many other jurisdictions deal with, which is removing more than they're putting in, or not having coordinated strategies. I know there's great work going on up there, though, and I know some people involved in that, but it's always about the net effect. We had a hand up there, I think, did we? We had Tom's hand went up again. Tom, if you'd like to ask your question, happy to have it.
Yes, thank you. The first comment was just to commend Shannon and Ethos. I was lucky to be involved in early stages. The alerts they gave, this is the temperature, are you looking at doing? Might we suggest you do that? And this actually came across. It's not quite AI, but it was sort of in that direction. And I thought that was not only a good study, but the way in which they fed that back. But I do have the question, totally unrelated, is that when we talk about these programs and various ones are talking about looking to upgrade or to assist, normally it's done on a retail price level, right? Whoever is running it passes it down the chain, and every time you pass it down the chain, you're increasing the percentage or the margin that particular handler gets. If, for example, there was a more intelligent procurement process and a voucher system, a little bit like Kevin 07's ill-fated but brilliantly thought about insulation program, if instead of criticising that, to learn from what they did, because if you do bulk in procurement, you're dropping the price by 25 and more percentage. So for those who are there and involved in how do we get it done, I would be one that would rail against just passing it down the retail profit chain and to look at, has anybody considered that notion of the intelligent procurement?
That is certainly an interesting idea. I'm not qualified to answer on it, but you raise an interesting question. Do we have anyone in the audience that is interested in speaking to that one? I mean, there are advantages, obviously, monetarily to procurement at scale, but it requires a great deal of strategy and programs to back it. And we have seen, as Tom mentioned, some of those programs come a cropper for one reason or another previously, particularly around home energy, insulation and efficiency. Anyone else want to jump in?
If I can jump in there, I've not heard that term, so I may not be speaking specifically to that, but there are a bunch of financial mechanisms, and one of the ones I mentioned there is the white certificate scheme. And so that's like, carbon trading and others, but it's where a third party will come in and install, say, light bulbs or more efficient devices and so on, and they get a financial credit where one certificate equals 1 megawatt hour of emission reduction or cost reduction, or, there's different ways of doing it. And whereas the rate-based mechanisms, things like that. So again, the work that ACOS is doing is looking at the financial mechanisms, because Tom's right, it does cost a lot. If we were to upgrade 1 million homes in Australia, that's millions of dollars. And we've got groups like Saul Griffiths talking about the postcode by postcode mechanism. And that's for people with money, so it doesn't really help those who don't have money or home ownership. So we need other mechanisms for that. But it can also be around the white certificates. The value there is because you're actually leading to a lower cost down the track. That's actually how you pay for it. So there are mechanisms out there, and it's just a case of having those plans in place. So I think to the Queensland government people online, there was a election commitment in 2016 for a white certificate scheme as part of the demand management energy efficiency strategy. And I know some work was done in the background modelling that, what it might look like. So review some of that and come up with a program.
Excellent. Thank you, Luke. Very much appreciate your thoughts on that. Shannon Rutherford's comment, we need good health economics analysis, as the health cost burden reduction would offset some of the costs of subsidising. Yeah, this is always a big one, I think, as well, personally, is quantifying the benefits of reducing the problem rather than looking at the cost of spending money on reducing the problem. Nicole, you had your hand up. Happy to have you come in.
Yeah, sorry, this is actually in relation to Nicole Manolius's comment, just about the heatwave stakeholder kit, and just in general, in putting together this presentation, I guess it became apparent to me that there's work being done at kind of like higher levels, in government and things like that, but on the ground, like most of my GP colleagues obviously know climate change is an issue, but maybe not aware of just how large an issue it is, and how many deaths and ambulance call-outs and hospital admissions are happening with rising temperatures. And so for me, there's a big disconnect between what's happening at the top and what's happening at the community level. And I think there's a lot to be said for community organising and working out how these things, they might trickle down slowly, but how do you engage people in communities or health services in communities to be able to be part of that solution, and many other community organisations. I just think that's something that we need to think about more broadly. We need people on the ground doing things as well.
I think just further to that point, Nicole, there's also the thing that we see as well around heat, which is it doesn't have the visual side of it that some of the other natural disasters have, which is, gives them a compelling presentation relative to heat. Heat is so much more subtle and hard to spot sometimes, and particularly its impact on individual people. Luke just pointed in there some good numbers on public health cost savings in Victoria. Thanks for that, Luke. That's something for everybody to follow up on. We're coming towards the end, friends. If we have last questions, happy to take them. If not, happy to wrap everything up and go back to our afternoon. I'm sure everybody's busy. We do have a few though. Maria, your hand went right up, so happy to have you jump on.
Thank you. I do have a question, I guess, around data and other research. So Nicole, thank you so much for your presentation and for sharing those important facts. So I am interested in building sort of an evidence base on the impacts of heat and humidity on human health. And the research that you mentioned, Nicole, on ambulance call-outs is a great resource. And I'm just wondering if there are other studies that this community is aware of that could demonstrate health impacts of heat. And I guess a side question to that, is there anything within our hospitals where they collect data on admissions related to heat stress or heat related illness? And also, is there a consistent sort of method of capturing and reporting on that data across the state or even Australia?
Excellent question, Shannon Rutherford. I feel you might have an answer for this, or some kind of an answer with your hand up.
Thank you. Look, I think it's a really good question. I think there's a lot of work happening across the country around heat and health, and also a lot of the solutions across both the disaster space and climate adaptation. I think the humidity question is an emerging issue in the research literature, and certainly there has been some work commissioned in other countries around this, and there's also some work that's come out from our team around multiple morbidity. So it's actually, if you have more than one underlying condition, then as your number of conditions increases, then your risk actually also commensurately increases. But we also have a grant right now through the HEAL group, Healthy Environments for Active Lives, I think it is, or something like that. Sorry, I should know that acronym. And that's about trying to get the research community across the country together to answer some of these questions. So how can we collectively pull the evidence base together and also engage with policy so that we're actually not duplicating and we're answering the questions that are emerging from the policy groups that are dealing with this kind of stuff and shaping the future. So I think it's very important point, and the HEAL work that's been commissioned is very small, but it will bring researchers across the country together, and hopefully some of that stuff will be put in one place through the HEAL. And HEAL has a knowledge translation platform, so there's a place that will be hosted. So just watch this space.
Thank you.
Yeah, thanks, Shannon. And I think also to acknowledge everybody that it's, 2 or 3 years ago, there wasn't nearly as much appetite or recognition of the need to collect this kind of data or even to link the issues together. I mean, we really have come a long way in a short period of time. And I would say especially over the last 2 to 3 years, we've taken a huge leap forward here in Queensland and nationally as well, but particularly here in Queensland. And they've been doing great work down in New South Wales for quite some time too. And it's great to see more and more coordination across the borders and scaling that up to national. So thanks, Shannon, for that. We have a question in the chat there from Angela Smith of Sunshine Coast. And the question is, I wondered whether critical infrastructure failure, in particular electricity networks, was being factored into work or recommendations for heat or risk management. While there's certainly no one single answer or silver bullet as a local government, we've had concerns with how much reliance is put on air conditioning to help manage people's heat exposure. And I think that is a fair question and a concern as well, particularly on days when the grid is at absolute capacity. Anyone in the presenter list feel like they want to take that one on or have anything to say about it?
Yeah, the energetic communities, we have a position that can be a bit different to others. And I think I agree with what Angela's indicating there. There's obviously a need for air conditioning, especially as heat becomes worse. But I think I sort of mentioned in my presentation around one of the risks is if we don't look at it holistically. So we need more batteries, whether they be network scale or household scale. And the government's federal government's $2.3 billion program wants to put 100 batteries. Or million batteries, sorry, on the grid. And the issue is that when people use air conditioning, and it's seen to be a human right by some people, where actually what's the human right is a healthy home. And that is more achieved through broad-based energy efficiency, climate resilience. And the time people use, we need to remember that people use air conditioning into the evening when the sun's not shining. So we end up actually causing and contributing to the peak. We end up using more gas as a result. So if people don't have batteries at the same time, then we can actually be leading to a maladaptation. And so, yeah, it's a big issue. And last week, AEMO, the Australian Energy Market Operator, acknowledged the role of CER, which is the consumer energy resources, including batteries and EVs. So we can quite quickly get into very energy technical space. And our fifth module talks a bit about this because it is a big issue and we need more of those broader consumer energy resources to make sure when we do use air conditioning, it's done well and it doesn't lead to adverse impacts. And the final point will be that the people we talk to, the low-income households and the renters, often turn it off even if they have air conditioning because they can't afford it, because it's also at the time when we have the high tariffs and it becomes really expensive to use at that time of day. So there's a bunch of things in there, but yeah, we do need air conditioning, but we need to be very clear how we do it and how it works with the system.
Super, thank you, Luke. And a follow-on comment as well in the chat from our colleague Fergus O'Connor, so you can read that for yourselves. Friends, I might wrap it up for the day, and thank you all for coming along and participating and being in the audience, and for such a spirited Q&A, but particularly a big thanks and our deepest gratitude to our presenters, Luke Reid, who spoke about energy efficiency and empowering renters, Monique Monte and Christabel Carval, who spoke about concession card schemes benefiting people suffering from heat health issues, and Dr. Nicole Sleeman, who spoke to us about building heat resilience in the heat sector. 3 fantastic presentations, a great Q&A, a great chat, some really high quality networking happening behind the scenes as well, as Luke pointed out, but we could see it for ourselves. And that's what we're here to do, and that's what we're here to facilitate. And we thank you all for being part of the journey. We will be back to you later in the year with further Queensland Heat Health Community of Practice events. We'll let you know about them in due course. In the meantime, please continue to work together, network together, and stay in contact with us here at the Griffith end of things if you ever need to. Thanks everyone for your time today, and especially to the presenters for taking the time to write presentations, share them with us, and deal with questions and discussion. Thank you everybody, and we'll see you at the next one.
Thank you very much.
Thanks.